As young adults in 2020, we have grown up with an ongoing opioid epidemic all around us. It is almost impossible to get away from. Sadly, most of us have been affected by someone else's opioid addiction or maybe even your own. Today, I will be talking about what opioids and addiction are, why you need to act upon early signs, and the treatments for addiction. This subject is close to my heart because I've lost a friend and my cousin this past February to this epidemic. Opioid addiction can happen to anyone, whether it is you personally, a friend, or family member. It can majorly affect you and leave a negative impact on your life. Opioids are prescription pain relievers that are highly addictive. Some examples include morphine, fentanyl, and codeine. Heroin is a semi-synthetic opioid because it is made from the natural opiate morphine. Addiction is a disorder someone has when their brain is dependent on the drug and engages their brain with feelings of pleasure, even if they're aware of the consequences. The drug targets the brain's reward system and floods the system with dopamine. Dopamine is a neurotransmitter which regulates emotions and feelings of pleasure. On ourtakeback.org, it states that psychological addiction with opioids can take place in just 3 days. In the late 90s, when opioids were on its rise, pharmaceutical companies told the medical community that people would not become dependent on them. The graph on the right, which I pulled from usafacts.org, shows how opioid addiction has been on the rise in the past decade and was declared a national health emergency in 2017. On average, opioids kill 130 people in the US each day. To help slow down the rise, pay attention for early warning signs of addiction in others. Sometimes early signs go unnoticed, which can potentially be fatal in the end. I have personally been in this situation and regret not taking action while I still had a chance. Flu-like symptoms appeared in my friend, and I realized she was spending tons of money but had no job. She ended up stealing from me, and instead of reaching out, I decided just to end the friendship, and not long later, she passed away. My cousin used to check up on me at least once a month, and for the last 8 to 9 months, I realized she wasn't reaching out anymore. She had a drug problem in the past, and to my family's knowledge, she had gone through treatment and had recovered. What is a huge risk with other drugs is that they can be laced with fentanyl, which is more deadly than morphine, even in small doses. This is what happened to my cousin. She relapsed after treatment, and she ended up overdosing after mistakenly ingesting fentanyl. My friend was in and out of rehab all of high school, but it wasn't effective, which leads me to my next and final point. The individual has to want the change in their life. You have to approach them with empathy and treat them like any other person and not like they're weak. For treatment to be effective, quitting an addiction to opioids cold turkey can cause severe withdrawal symptoms and could even be fatal. Usually when someone seeks help, they are given medications, participate in counseling, or MAT, which is medications with counseling, to prevent substance abuse and overdose. MAT has a higher success rate for recovery. The medicine doctors prescribe decrease withdrawal symptoms and is not used as a substitution for the last addiction. There are publicly funded facilities, but cost can still be a barrier. From HHS.gov, it states that in 2017, 2.1 million people used opioids and less than 700,000 sought any type of treatment. This is maybe 32% of the using population. Some worries were that they might lack health care insurance or their insurance doesn't cover treatment for addiction. After a friend or loved one gets out of treatment, you should know the warning signs of a potential overdose, learn how to administer Narcan, and what to do when someone you're with is overdosing. After today, I hope you'll have an extended knowledge of opioids and addiction, the early signs of addiction, and why it's so important to not let any of these go unnoticed, and also the types of treatment for recovery. Spreading awareness for opioid addiction will always be a passion for me because I want to decrease the risk and rate of what I had to go through. Thanks. Oh my gosh, that literally was not